Okay, what I'm going to do is remove the anterior chest wall, and then I'm going to open up the abdominal muscles. And so what we are doing here is looking at the thorax and the abdomen. I'll give you an overview, and then we'll concentrate on some systems here. You can see lungs, heart, diaphragm, liver. This individual had a tumor, a rather large tumor here, that has distorted the stomach, and so instead we see the duodenum pushed to the surface. This is called the greater omentum. It's the lay term is the fatty apron, and it hangs like that. So let me move it up here and show you the small intestine as well as part of the large intestine. Now, let's get down here and take a look at our anatomy, digestive anatomy first, or mostly a digestive anatomy. This is the greater omentum that I mentioned. It's been dissected. It hangs from the transverse colon. But you're probably noticing first the liver. Let me show you the liver here, the right lobe, the left lobe. This is the falciform ligament. There are membranes throughout the abdomen that suspend the various organs and also bring a blood supply. So that's our falciform ligament. This would surprise you. It just looks like sort of a string of connective tissue, doesn't it? It is that, but prior to birth, this was the umbilical vein. Umbilical veins contain red blood. Most veins contain blue blood, unless they're pulmonary or umbilical. The red blood oxygenated at the placenta from the mother's oxygen supply before birth comes through the umbilicus, separates from the umbilical arteries, and takes blood right through the liver to the inferior vena cava. Well, after we're born, of course, nobody cuts the internal fetal structures. They remain for life. This becomes just a connective tissue, but it's the remnant of the umbilical vein. So there you have it. If you look here, you can see the gallbladder. The color of it reflects the color of bile, which I have to admit is sort of an odd shade of green. But there you have it peeking out from the liver. This liver is slightly distorted because of the tumor here, which is abnormal anatomy, but this is certainly very interesting anatomy. What we have here is the duodenum. The duodenum means 12. It's approximately 12 inches long. Sometimes people say it's 12 fingers thick. I only have 10, but imagine 2 more. The word duodenum means 2 and 10. This is far distorted from its natural position due to the tumor. It would lie deeper here, and the stomach would cover it. Well, meanwhile, the stomach has been pushed way up here. But the duodenum is the first part of the small intestine. And let's see if we can find the rest of the small intestine. The jejunum, which means empty, is the second part. It's about 8 feet long. And you can see that it's wrapped in membrane, which is typical of the small intestine and many organs within the abdomen. This is called the mesentery proper, and that's invested with fat. It explains abdominal fat. There's a lot of places why we store fat for a famine in our abdomen. Farther on, and I can't tell where, but as we get to the end of the small intestine, we come to ileum. Unless you take it under a microscope and look at it, when you just pick it up, you're not sure whether you have jejunum or ileum. But the ileum is the last 12 feet of the small intestine, and it ends by entering the cecum, which is the sac that I'm holding here. Let's see if you can see that a little better. And appended to that sac is the appendix. Now this is a tiny appendix. Sometimes appendices will be enlarged because of inflammation. There's a lot of lymphatic tissue within. Its true name is the vermiform appendix, which means worm-shaped. But it's a storehouse of lymphatic tissue. The cecum then is the beginning of the large intestine, and we have an ascending colon, which is a little hard to see here. Then we have a bend in the road called the hepatic, meaning the liver flexure, the hepatic flexure, the liver bend. It's the location where it bends. Transverse colon. You know, sometimes we imagine that the reason our stomach seems to hurt, it's our stomach. We say our stomach hurts. It can be the colon, gas or irritating fluid there. You can see the transverse colon coming along. Another bend in the road, which is the splenic flexure. And then the descending colon. The descending colon then hits an S curve and is called the sigmoid colon because it means, sigmoid means S-shaped. Boy, that's a long sigmoid colon there. You can see there. That sometimes, you see that sometimes in older people. And then down to the rectum. Since I mentioned the spleen, I want to show you the spleen. Here it is. It's about the size of our fist. Well, you can see for yourself. It lies in the left upper quadrant of the abdomen, right beneath the diaphragm. And I'll pull it out for you about as well as I can. That's a normal sized one there. And since I'm in the vicinity, I'll also show you the liver, or excuse me, here's a liver, kidney. The kidney is what we call a retroperitoneal organ. That means that it's naturally covered with this membrane. In fact, to see it, we had to remove the membrane that you see here. And so there's the kidney. I can see arteries and veins entering and exiting it. It's a little smaller than average, perhaps, but pretty normal looking otherwise.